Thank you, Madam Speaker. Madam Speaker, I wish to thank you most sincerely for the opportunity to render a ministerial statement to update this August House and the general public on the influenza and COVID-19 situation in the country. Madam Speaker, during this time of the year, when the weather is cold and dry, it is expected to see an increase in respiratory infections. As a result, our Surveillance and Disease Intelligence Wings under the Ministry of Health continues to conduct routine surveillance of diseases of public health significance. Further, we have surveillance of influenza in selected sites under the National Influenza Center, operating under the University Teaching Hospital Virology Laboratory. These sites are in Chipata, Livingstone, Lusaka, Nakonde, Ndola, and Solwezi. Madam Speaker, we have thus seen an upsurge in the number of respiratory infections as we have been monitoring the trends of reported respiratory infections and influenza-like illnesses. I wish to inform the general public that following the analysis over the last 4 weeks of the 373 samples collected from our influenza surveillance sites in Chipata, Livingstone, Lusaka, Nakonde, Ndola, and Solwezi, 35, representing 9%, were positive for influenza. Specifically, 21, representing 6%, were positive for H1N1. 12, representing 3%, were positive for H3N2, and 2, representing 0.5%, were positive for influenza B. Of the 35 positive samples, the majority, 15, were from persons aged 18 to 49 years, while 13 were under 5 years of age. None of the samples came from persons aged over 50 years. Madam Speaker, as of today, the 12th of July, 2024, we have 13 patients admitted to the University Teaching Hospital. That's a total of 13 persons, of which 11 are at UTH, 2 at Levy Hospital, with severe forms of pneumonia caused by influenza and coronaviruses. All these 13 individuals are receiving oxygen as part of their management. Only one, however, is in critical condition. We unfortunately lost one male patient who also had severe pneumonia caused by influenza and another bacterial infection. Madam Speaker, influenza, commonly known as the flu, is a contagious respiratory illness caused by influenza viruses. There are 4 main types of influenza viruses. These are A, B, C, and D influenza viruses. However, the types that commonly infect humans and cause seasonal epidemics are influenza A and influenza B. Influenza A viruses, however, are further classified into subtypes such as H1N1 and H3N2. Madam Speaker, influenza viruses spreads mainly through respiratory droplets when an infected person coughs or sneezes, as well as through close contact such as handshakes and hugs. The virus can also survive on surfaces and objects, but for a short time. Therefore, if a person touches a surface that has the influenza virus on it, and these surfaces could be a door handle, or a light switch, or a tissue that has been used, and then you touch your nose, you touch your mouth, or eyes, then you can easily become infected. Influenza can cause mild to severe illnesses. Symptoms usually come on suddenly. People who have influenza will often feel some or all of the signs and symptoms as follows. 1, fever or feeling feverish, chills. Or 2, coughing. 3, sore throat. 4, runny or stuffy nose. 5, muscle or body pains. 6, headaches. 7, fatigue, what you'd call body tiredness. And lastly, some people may have vomiting and diarrhea, though this is more common among children and children more than adults. Madam Speaker, most people who get influenza will recover in a few days to less than 2 weeks. Some people will, however, develop complications such as pneumonia, some of which can be life-threatening and result in death, as was the case with the patient we've just talked about. Other complications are ear infections and inflammation of the heart, brain, or muscle tissues. Influenza can infect anyone regardless of age. However, the severity of the illness and the risk of complications can vary significantly among different age groups. High-risk age groups include young children under 5 years old and the elderly, pregnant women, and people with chronic health conditions such as asthma, diabetes, heart disease, and weakened immune systems. Madam Speaker, allow me to take this opportunity to also update the House on the COVID-19 situation in the country. I'm aware that people remain quite anxious whenever there is a spike in respiratory infections, and understandably so, especially given our recent experience with the COVID-19 pandemic. We have continued, however, to separately monitor the COVID-19 trends and have seen a slight increase in the weekly positivity of samples being tested for COVID-19, from 1.5% to 2.8% positivity. Specifically, our recent data indicates that out of 322 samples that were tested for COVID-19, 9 samples, representing 2.8%, were positive. When we look at our monthly trends between the month of May and June, we tested 3,070 samples, and of these, 74, representing a 2.4%, were positive. Of the positive samples, 43 came from Lusaka province, 9 from the Copperbelt province, 7 from Southern province, 6 each from Central and Luapula provinces, 2 from Eastern province, and 1 from Northern. Muchinga and Western provinces did not record any positive cases. Cumulatively, between January and June of this year, we have recorded a total of 4,770 cases. The top 5 districts from which these cases were reported are as follows: Chingola, 478, Lusaka, 451, Kabwe, 433, Kalulushi, 213, and Chililabombwe, 196. Madam Speaker, our experience with recent outbreaks such as cholera and COVID-19 has gone a long way in teaching and reminding us of the importance of good hygiene and respiratory etiquette. These very habits are critical to prevent the spread of influenza. We are, therefore, all encouraged to continue to implement preventive measures, including the usual: wash your hands frequently with soap and water for at least 20 seconds. Use hand sanitizer if soap and water are not available. 2, cover your mouth and nose with a tissue or your elbow when you cough or sneeze. Dispose of used tissues properly. 3, regularly clean and disinfect frequently touched objects and surfaces. 4, avoid close contact. Stay away from people who are sick. If you are sick, stay home to prevent spreading the illness to others. And if you are infected and need to go out in public, always wear a mask. We do not currently have influenza vaccines in our national immunization schedule, Madam Speaker, but we do have COVID-19 vaccines, and those eligible are hereby encouraged to get immunized to protect themselves against severe disease and bad outcomes. Madam Speaker, this government, under the able leadership of His Excellency, Mr. Hakainde Hichilema, the President of the Republic of Zambia, is committed to ensuring the health and safety of our people, and to providing timely public health information to prevent the spread of diseases like influenza. As a result, we have activated the detection of these viruses and other germs or pathogens at the University Teaching Hospital using a multi-disease diagnostic platform. These platforms will be opened in other provincial centers around the country. In fact, in all the remaining. These platforms will be able to detect many pathogens, not just these viruses. Further, we have put all our health facilities to be on high alert for suspecting and screening for these infections. Management plans have been refined and dedicated spaces have been created for managing our people. In addition, we've made sure that we have constant and adequate availability of oxygen. We have also activated the procurement of specific medicines for the treatment of influenza. We have further made sure that we have commodities needed for the management of COVID-19 and other respiratory bacterial infections which are currently circulating around the country. I wish to use this opportunity to call upon all health workers to please monitor closely those infected by these viral infections and make early detection and early appropriate management. Madam Speaker, as I conclude, I also call upon colleagues in this House and members of our community to follow the guidelines on hand hygiene and cough etiquette and reporting early to health facilities when unwell. We can indeed work together to reduce the impact of influenza and related illnesses in our communities. Madam Speaker, I thank you.